For several years, our country has experienced intense, often passionate debate about reforming healthcare services. Given these complicated discussions, it is useful, I think, to ask, why are we doing all this in the first place? The answer is that the health of our population and the care they receive simply is not as good as it should be. We spend more on healthcare than any other country, but when compared with 37 other developed countries, the U.S. ranks 30th in life expectancy. That's 30th out of 38. We are tied with Chile and behind Greece, Italy, and Slovenia. Our infant mortality rates rank 35th out of 38. Senator Daschle is correct. The fundamental challenges we face are cost, access, and quality. I would put the focus on cost and quality. Access is largely a secondary problem resulting from the high costs. Why are costs so high? The major cost drivers are higher healthcare prices in the U.S., poorly coordinated care, more costly procedures, and an immensely complex system where administrative costs consume as much as 25% of the total bill. U.S. physician practices spend 4 times as much on administration as do physicians in Canada providing the same services. Furthermore, current payment structures provide no incentive for providers to practice in efficient and cost-effective ways. All too often, the incentives are actually in the opposite direction. The more one does, the more one gets paid, whether or not the extra interventions contribute to a better outcome for the patient. So what about the ACA, Obamacare? With the ACA, we have made some progress in the right direction. Contrary to what the critics charge, the ACA has not led to runaway costs. In the last 5 years, cost increases have been significantly lower than in the preceding years. Medicare solvency has been extended. Access has improved. The number of uninsured Americans is at the lowest level in decades. Quality has improved. The number of hospital readmissions has declined, and hospital complications have been reduced. All of this is encouraging, but it is only a start. We must remember that we are dealing with a huge and enormously complex system. The challenges are confusing and highly vulnerable to misrepresentation and demagoguery. There are no quick fixes. Change is resisted by powerful forces that benefit from the existing structures. Special interest lobbies protecting their piece of the pie. As a society, we are committed to free market principles, but the economics of healthcare all too often demonstrate abject market failure. Effective healthcare is a vital component of any modern society. We need to support changes that reward efficient and effective care. These services must be available to our entire population. We must move beyond the political and ideological battles that stifle creativity and block progress. People of good faith with differing perspectives should come together and not fear compromise. We need to move beyond the cries for repeal, build on the accomplishments we have, and move toward the high-functioning healthcare system the U.S. public deserves.